Thank you for tuning in. You're watching Arirang TV's special continuing coverage of COVID-19. I'm Min San-hee. Starting tomorrow, sales begin for face masks that are easier to breathe in light of the hot and humid summer season. They're expected to cost 500 won each, roughly less than $50. Now, we have more on masks in general later on in the program. But first, as always, here are the headlines for this Thursday with our Kwon So-ah and Noaram. Hello.
Hi.
Good afternoon.
So I hear we have a drop in new cases here in Korea today.
Yes, we do. We have exactly 10 less cases compared to yesterday, but it's not time to relax as of yet, as one community spread after another is adding to the daily caseload. This Thursday, we have 39 new cases. The death toll remains at 273. 857 people are in quarantine, and almost 10,500 people have completely recovered from the coronavirus. Now, our daily infections peaked at 79 a week ago, but then we saw a drop to the 50s and 30s. Again, a slight surge we had yesterday to 49, but now we are back at 39. And by region, we have a lot of new cases in the capital region with Seoul, 14 new infections, 15 in Gyeonggi-do province and 7 in Incheon, and 1 case down in Gyeongsangbuk-do province, while 2 cases were detected at the airport and 3 out of the 39 cases were imported cases. Now, authorities noted the pattern of recent cases being sporadic cluster infections in the metropolitan region, out of which many were transmitted through asymptomatic patients, stressing the need for residents in this region to abide by quarantine measures. Although Thursday's new numbers are lower than the day before, officials are not ruling out the potential of a second wave fueled by a steady rise in cases linked to small church gatherings and continuous chain transmissions from earlier clusters that started in the Itaewon district in Seoul and Bucheon city in Gyeonggi-do province. And people in the greater Seoul area have been asked to postpone gatherings and turn to non-contact alternatives.
Right, and health authorities have also announced plans to hold a training session regarding hospital beds in the metropolitan area.
Yes, in the metropolitan area, because these cluster infections are spreading in that region, a training session is to open Friday regarding the joint access of sick beds to use them more systematically and efficiently. Public officials, health and fire workers, as well as experts will be involved in this virtual training, which will simulate an emergency situation in which there is a sudden surge of people who test positive for the virus. This is to prepare for any contingencies in the densely populated Greater Seoul area in the case there is a lack of hospital beds, and also to make sure that patients are categorized according to the severity of their condition for efficient treatment. So that would be similar to what we saw earlier in Daegu, where we had a really massive spread of cases before.
Right, so okay, what's the latest on the global front?
Well, more than 6.57 million cases of the coronavirus have been reported as of Thursday, Korea time, with less than half of those, around 3.17 million, having recovered. If we take a look at our world map, these are the 213 countries and territories that are affected by the virus now. More than 388,000 people have lost their lives. More than a dozen countries have over 100,000 infections, and the latest country added to that list is Mexico. The U.S. remains the only country with over 100,000 fatalities, approaching 110,000, and the UK's death toll is nearing 40,000, and Brazil and Italy have some 32,000 and 33,000 deaths respectively. Now, India's infections are still ticking up, now showing more than 216,000, and Turkey has more than 160,000 cases now. And although not on the list, Chile and Mexico are the latest countries that have more than 100,000 cases.
Now, we've been talking about many countries in Europe gradually reopening their economy. I understand they're also reopening their borders to each other.
Right. Europe, which has been a hotspot of the coronavirus before, is slowly recovering, although depending on where you are, the situation may be different. Now, one of the worst hit countries, Italy, has lifted travel restrictions on Wednesday, with almost everyone now allowed to travel around the country and also to other European nations and vice versa. Italy was the first country country in the world to implement a strict nationwide lockdown almost 3 months ago when COVID-19 was officially designated a pandemic. Although infections and deaths have gone down significantly, though, daily fatalities still remain in the double digits. Now, Germany on Wednesday announced to ease its travel warning, allowing travel within at least 29 countries in Europe beginning June 15th. However, officials warned that this is not necessarily an invitation to travel, as there are concerns that a reopening of tourism could lead to a second wave of COVID-19. And Belgium followed suit with Germany's announcement, planning to scrap its EU travel restrictions on June 15th as well. And similar moves are expected in the Czech Republic and Slovakia, which are looking to open borders in gradual steps, starting with the one between each other. And those are the global updates.
All right, so thank you. Stay with us for more on the domestic updates after the regular briefing.
Will do.
Arirang, words of caution from President Moon Jae-in regarding the recent rebound in cases.
That's right. He wrote on his social media account that he thought the country had turned a corner with this pandemic, but obviously that wasn't the case. Now, the president urged the public not to lower its guard, citing continued cluster infections in Seoul and its surrounding areas. Moon also called for stronger efforts to prevent further spread and highlighted the need for enhanced quarantine measures. The president noted it's realistically difficult for the government to control every small group meeting and activity, and therefore he urged the public to avoid small religious gatherings, as most of the cluster infections came from church gatherings, and he also called for everyone to abide by quarantine rules as well.
Right, and Korea's diplomacy amid the pandemic continues, I hear.
That's right. Foreign Minister Kang Kyung-hwa called for countries to keep up cooperation in maintaining what she called openness by allowing essential trips by business people and humanitarian workers despite the pandemic. And she made that call during a six-nation video conference involving the US, Australia, Brazil, India and Israel. Now, Kang also pledged that South Korea will, quote, constructively contribute to international discussions on enhancing international healthcare governance. Kang said South Korea has effectively contained COVID-19 while keeping its borders open, urging other nations to do the same. And as we heard, Europe is following in those footsteps at the moment. The top diplomats also agree that close communication and cooperation are vital in containing the spread of the virus, as well as normalizing economic and social activities.
Right, and officials here, I understand, are boosting efforts to develop a COVID-19 treatment.
That's right. So Korea is aiming to develop treatments by year's end and vaccines by the end of next year. That is the aim at the moment. And the government is promising full support to drug companies working on treatments and vaccines. And the government will also inject some 100 billion won, or $82 million, in the second half of this year to help in that effort. That money is likely to come from the third extra budget bill that is awaiting parliamentary approval at the moment. And the use of blood plasma from infected patients is being looked at as one method of the treatment. We've mentioned this before on a previous episode of the show. Now, this is because the antibodies that are formed could prove to be useful in the treatment. And meanwhile, the government has recently decided to allow the use of the antiviral drug remdesivir as an emergency treatment for COVID-19 patients, similar to what the US did. And Korea is, however, yet to complete clinical tests on the drug, so we'll have to wait for the results of that.
All right, Aram, thank you for that. We'll see you again tomorrow. Now, we turn now to the regular afternoon briefing on COVID-19 here in Korea. And as we wait for that to start, here are a few reminders for our viewers in the country. The weather is getting hotter, and those of you choosing to use air conditioners indoors, remember to ventilate at least once every 2 hours. Also, in the case of being in an air-conditioned space where ventilation is difficult, health authorities are calling for the wearing of face masks to better prevent the spread of COVID-19. Also on the subject of face masks, as I mentioned at the start of the program, those that are thinner and easier to breathe in will be available on online markets starting tomorrow before hitting offline stores soon. They'll also cost about 500 won, which is roughly less than half a dollar. And do keep in mind that face masks are recommended on all forms of public transportation, including taxis, whose drivers have the authority to refuse service to those who violate this recommendation. Meanwhile, on the list of the recommendation that is the avoiding of crowded and confined places, including places of worship and cram schools, with lawmakers currently looking into ways of strengthening regulations on these private learning institutions as part of efforts to stem the spread of the virus at these education centres. We are still waiting for that briefing to commence. Perhaps as we wait, we can take a look at the daily life quarantine measures recommended by health authorities in place of these stringent guidelines that we had earlier. The first is, if you do feel sick, you are required to stay at home for at least 3 or 4 days. Also, do keep your distance from those around you. And remember to wash your hands for 30 seconds and to cough into your sleeves. Like I said earlier, in the case of using air conditioners, or even if you're not using them, remember to ventilate enclosed spaces at least twice a day. Also, the idea in Korea is far from body but close at heart. So do remember to reach out to loved ones and friends. As Soa mentioned earlier, our daily new cases today rose by 39 cases, raising our total to 11,629. Fortunately, we did not lose any lives today, keeping our death toll at 273. We are still waiting for that briefing to commence. Our Aram mentioned earlier, but blood plasma treatment is on track, and health authorities are calling on those who have recovered to donate their blood for further research on this. Right, I understand that the briefing has started, so we'll come back to you afterwards.
Let us now begin our regular briefing for the COVID-19 response here in South Korea. As of June 4th midnight, we have 39 new cases, increasing the total number of confirmed cases to 11,629. 32 more people have fully recovered, and a total of 90.3% of the total confirmed cases have been discharged. A total of 857 people are in quarantine, and the death toll remains unchanged at 273, and the fatality rate now stands at 2.35%. Yesterday, we had 39 new cases. Out of them, 6 are imported cases, while the rest 33 were locally transmitted cases. Looking at the imported cases, from America, there was 1, 2 from Pakistan, 1 from UAE, 1 from Qatar, and 1 from the Philippines. And as of noon today, here are some updates on the domestic cases. In the Kupang Logistic Center cluster in Bucheon City, Gyeonggi-do Province, compared to the day earlier, we have 1 more case. The total now stands at 120. Out of them, the workers of the logistics center are 77, and the contacts amount to 43. And related to newly planted churches in the metropolitan area, there are 11 new cases. A total of 66 people have been confirmed to date, and 38 are from Incheon, 18 from from Seoul, and 10 from Gyeonggi-do Province. We are currently undergoing a contact management and investigation. As for a Kumpo Anyang pastors meeting, we have 3 more cases and increase in the total to 8. And 6 of them are the members who were at the meeting, and 12 of others are also the contacts. And in relation to the CCC, the College Christian meeting, we had additional case, and a total of 11 people have been confirmed to date. And at the KB Insurance company at Junggu in Seoul, we had 1 more additional case, bringing the total to 12 as of now. And we have a new cluster infection at a business establishment called Richway in Seoul Gwanak-gu district. We have found 9 confirmed cases, new cases, and the total now stands at 10. And these are the visitors and the employees, and we are still conducting our testings and epidemiological investigation for this business establishment. Looking at the sources of infection, 71.8% of the recent cases were cluster infections, and we have about 3.8% of them, which is about 43 cases, have unknown sources of infection. And we have also found that 73.3% of the latest outbreaks are clustered here in the metropolitan area. And they spread through many multi-use facilities, including group meetings, business establishments, PC rooms, and other multi-use facilities. And if such trend continues, we have a risk of widespread cluster infections going forward. The COVID-19 spreads fastly among confined and crowded close contact places, so we advise all of the residents living in the metropolitan area to postpone or cancel your gatherings or social outings and refrain from going to multi-use facilities, including restaurants. And we also urge you to keep your life quarantine measures, including wearing a face mask, washing of your hands, and keeping distance of 2 meters. And as for religious facilities, we ask you to refrain from dining together or having group meetings which could increase the respiratory droplets infection, and please switch to non-physical contact. And if you have to meet face-to-face, please ensure that you have a distance among each other and reduce the number of participants, and please check people for their suspected symptoms, and you also need to wear your face mask. And during your meeting or service, please refrain from eating together, and please refrain from engaging in activities that may increase the risk of a droplets infection. As for the metropolitan area, we are seeing increased cluster infections among the venues like nightlife venues, singing rooms, after-school private academies, and PC cafes, which are currently under gathering ban or recommendation to limit operation. If operation is unavoidable, such facilities must follow all infection control measures, including maintaining a log of all visitors, requiring mask wearing, preventing entry of symptomatic persons, checking workers for symptoms, and sending symptomatic people home directly. And also, the municipal governments need to enhance their inspections to ensure high compliance of the infection control measures by such facilities. And we are currently in the process of developing the plasma therapy, and we have newly learned that 6 more people have donated their blood, and we thank them all for your cooperation. And please continue to actively take part in the blood donation. As we mentioned before, plasma therapy development is aimed at concentrating the antibody from the patients who have fully recovered to cure other COVID-19 patients. And if you are aged between 18 to 65 who have been confirmed with COVID-19 and has fully recovered and discharged from isolation, you are free to participate. Thank you very much.
Right, that was JoongAng, the head of KCDC, with Thursday's afternoon briefing. So do give us a summary of the key announcements.
All right, well, let's start with the last issue Chung mentioned regarding the plasma treatment research, which I believe Adam also talked about before. She said that there were 6 additional people who donated their plasma, and those were people who fully recovered from the virus before. So anyone who is between the age of 18 and 65 and who has tested negative after testing positive before, they can participate in this research by donations. And she also mentioned that out of the 39 cases that we had today, 6 cases were imported cases, and they came from a variety of countries like the Americas, Pakistan, UAE, Qatar, and the Philippines, while the rest of the 33 were community spreads, and those were all from the metropolitan area. And that is because we have additional cluster infections. For instance, the one related to small churches. We have 11 new cases. That brings the total to 66. And in Bucheon, there was 1 additional case, bringing the total number of infections at that distribution center we talked about oftenly to 120. But that's not all. There are also other sporadic cluster infections that newly emerged, such as at offices in the capital, Seoul. So Chung again asked for the nation's people to abide by the quarantine measures, especially people who go to these small church gatherings. They should try to avoid offline gatherings. And if they really do have to meet, do not eat together and wear masks, and also don't chant together.
I see. All right, so thank you for that. We'll see you again tomorrow.
Thank you.
Right. During a webinar last month hosted by the World Health Organization, a Korean hospital secured the spotlight for sharing its COVID-19 strategy. Our reporter Chun Song-cho is out there to give us more. Hello, Song-cho. Do tell us where you are.
Good afternoon, Sunny. So I'm reporting live from the Catholic University of Korea Eunpyeong St. Mary's Hospital in northwestern Seoul.
Song-cho, is that a hazmat suit I see you wearing?
Yeah, so this PPE, or personal protective equipment, it's almost like shields and armors for frontline workers these days. This is what they depend their lives on. And as you can see, I'm fully dressed from head to toe. I have this visor on. I have 3 layers of gloves, guys, 3 layers of gloves. And I feel kind of claustrophobic inside. You know, my breathing is kind of restricted. I'm kind of running out of breath. But this is what the healthcare workers depend their lives on. So this is very crucial. Before that, I want to show you guys a little bit the hospital. If you've been to a general hospital recently, you might have noticed these kiosks set up by the entrance. So for whatever reason you're visiting the hospital for, you have to fill up an electronic medical questionnaire here. So you write down information such as if you've been to overseas in recent weeks, or if you have symptoms like COVID-19, a fever or a cough in recent weeks. And if you, after you fill out the questionnaire, you get this visitor's pass like I'm holding here over here. And this is the key that will get you through to the hospital building. And inside you get your body temperature checked, and you perform hand hygiene and so on. I mean, all of this process can be quite overwhelming, to be honest, but the hospitals are taking no chances whatsoever. And this hospital in particular is gaining a lot of attention for its COVID-19 response medical system. And Professor Choi Jung-hyun recently had the opportunity to introduce the system to other experts on the global stage. And he is actually with us this afternoon, joining our show. Good afternoon, Professor.
Yeah, good afternoon.
All right, so thank you for joining our show. So you were a speaker at a webinar hosted by the WHO last month, and your presentation was titled Patient Safety and COVID-19 in South Korea. So can you briefly explain to us what it was about?
Yeah, on May 8th, there was a web seminar hosted by Department of Integrated Health Service of WHO. It was a time to share the situation and strategies of several countries to ensure patient safety in the middle of COVID-19 pandemic. I presented the current status of COVID-19 in Korea, processes and guidelines established by our hospital to respond to COVID-19, medical dilemma, and what should we prepare for the second wave.
Wow, I hope this system can be put in work in other countries and help save more lives. Thank you so much, Professor, for your time this afternoon. Thank you. All right, so if you are visiting the hospital because you're showing symptoms of COVID-19, or you came into contact with an infected person in recent weeks, then you will be directed to a separate center, separate from the main hospital building. And this is the screening center over there. It's on the opposite side of the road, and this way the hospital can make sure that we can minimize the risk of COVID-19 patients coming across with general regular patients at the hospital. And I can see there are some healthcare worker dressed fully in PPE, just like myself. So I'm going to ask him a couple questions. Good afternoon, Professor.
Good afternoon.
Good afternoon. So I see you're holding this cotton swab thing. Is this a testing kit for COVID-19?
Actually, it's a sample collecting kit. We put this cotton swab deep into nostril and rub mucosa to get viral particles, and then we amplify viral RNA to confirm whether COVID-19 virus exists or not. We can get result within 4 hours.
Wow. So that must be very uncomfortable to have that all the way in the back of your throat. So as you can see, you're fully geared up in your PPE, and it must be really exhausting and tiring to work in this suit all day long. What is it like working for you guys these days?
It's really hard, especially this summer season, but it does not matter. We are doing what we have to do. It's our responsibility. We do our best until we overcome COVID-19.
Oh, wow. Thank you so much for your service, Professor. Thank you.
Thank you.
Thank you. Yes, so, I feel like it has only been like 30 minutes since I put this on, but I'm already fully drenched and sweat inside. I can't really breathe properly, and I cannot imagine what it must be like to work all day long, taking long-hour shifts in this gear. I want to extend my deepest and fullest respect and gratitude to all the doctors and nurses who are selflessly and tirelessly giving up and sacrificing their time to take care of COVID-19 patients. This has been Chun Sung-cho reporting live from Eunpyeong St. Mary's Hospital in Seoul, and back to you guys in the studio.
Right, Song-cho, thank you very much for that. The same words of appreciation from us to those doctors out there. That was our Chun Song-cho reporting live from Eunpyeong St. Mary's Hospital. Now, staying with efforts by healthcare workers at the front lines of the battle against the pandemic, many of them are exposed to potential danger even during the process of testing people for COVID-19, as our Song-cho just explained to us. Accordingly, to better protect these medical professionals, a research team in Denmark has made an automatic robot capable of carrying out COVID-19 tests. I have the professor in charge of that project live on the line. Hello, Professor.
Hello, good afternoon.
Good afternoon, Professor. Now, before I delve into your development, do tell us a bit about the COVID-19 situation in Denmark.
So after a lockdown, Denmark is starting to opening up again. And we see that the number of infected persons are dropping. So we are in a healthy curve at the moment, and we hope that it will continue that way.
Professor, you've created a robot that is able to conduct COVID-19 tests, essentially protecting the medical staff from potential exposure to the virus. Please tell us how the robot works.
Yeah, well, the robot is automating all the processes in collecting a sample. So that means in terms of preparing the sample container, taking out the swab from the sterile packing, and then basically identifying the poses in the throat where we need to do the sampling, move the swab into the throat and collect the sample. Then afterwards, putting it into the container, breaking off the stick, and then putting on the lid.
It sounds quite
So pretty
convenient.
much everything. Yes, we hope so. So again, as you said, we wanted to try to protect the healthcare workers. So in order to do that, we have to automate all the steps.
Professor, one final question. What are your future plans with regard to this feat?
So we hope that now the prototype is out of the university lab, and a company can take it swiftly to the market. And in order to do that, we need to test it properly.
All right, Professor, thank you very much for taking the time to share with us live your achievements in the fight against the pandemic.
Thank you for having me.
이태원 클럽발 N차 감염이 끝나지 않았고 부천물류센터에서의 감염은 이제 시작이라고 보고 대응하고 있습니다.
In today's studio session, we explore the facts and fiction surrounding COVID-19, including those about face masks. For more on this, I have Professor Kim Mina from Asan Medical Center. Welcome to the program, Professor Kim.
Thank you. Thank you for having me today.
Right, you're welcome. And I have Jim Bulley, the editor of Korea JoongAng Daily. Hello, Jim.
Hello.
Right, Professor Kim, we'll start with you. How do you assess the severity of the latest rise in cases in the metropolitan area?
We know that we are not going to be able to go back to normal until we have a safe and effective vaccine. Most experts are saying it's at least 12 to 18 months later. In the meantime, we have to fight COVID-19 only by old-fashioned quarantine measures and personal hygienic attitude. This is only slow second wave. The current situation in Seoul and Metropolitan area suggests that more cases are spreading in the community. So I believe that we should prepare for a second wave, even multiple waves, at least for further another month.
I see. Jim, over in the US, I understand that the cases of COVID-19 in Washington, D.C. is on the rise, and experts are linking this rise to the massive public protests that have been taking place there and, of course, in cities across the world. What are your thoughts?
I mean, absolutely, inevitably, protests are going to cause a spike in cases, people gathering, but there's also a lot of compounding factors that make it worse. Firstly, when you're protesting, you tend to be shouting. You know, I mean, COVID-19 is a virus that is spread through droplets from the mouth, so shouting affects that. Also, a lot of the measures that are used by police, by law enforcement, tear gas, these things make people cough. Pepper spray, they're designed to make people cough, and that, of course, spreads the virus further. There's also a question of whether people are wearing masks, either by choice or availability, especially across the US, which can have a huge impact. If you're imprisoning people, then inevitably you're putting people in a tight enclosed space together again. And then there's also the fact that COVID-19 has a disproportionate impact among Asian, Caribbean and Black people. And that is a large part of the group of people that are going to be protesting. So for any number of reasons, there has been a definite spike, and there will be a spike caused by these protests.
Right, that's quite unfortunate to hear. Professor Kim, how effective is the wearing of face masks in the presence of such large crowds, like the crowds we're seeing in the US?
Actually, I was also watching the news because it was an area with many Korean immigrants and visitors. On the news screen, I saw the crowded protesters shouting on the street, and some of them actually did not follow the rule of social distancing and mask wearing. There are two recent big events in the United States, and social reopening and mass protest, and both of them may synergistically increase the risk of COVID-19 transmission in the United States, I think.
And Professor Kim, you recently wrote an article, a paper, on the effectiveness of dental masks in protection against airborne disease. Can you tell us a bit more about that?
Frankly speaking, it is the expert opinion. Journal of Korean Medical Science has a section for it. I'm not a mask expert, but an infection control expert. That is professional mask users. As you know, most outbreaks occurred in 2015 when I was the Vice President of Infection Control and Prevention Society. And our society at that time has established the guideline for controlling MERS outbreak in healthcare setting, in which the MERS patient was recommended to wear surgical mask, healthcare workers to wear N95 masks. It's not the new research topic to prove surgical mask suitable to prevent droplet. So there are two kinds of masks used in hospital. One is to protect others from virus droplet, and the other is to protect the wearers from infectious aerosol particles. And as you said, surgical mask is thinner and easier to breathe than KF95 masks because they have to use for hours during surgery. The surgical masks are used to protect the operation field from droplets generated from surgeons talking and coughing. Its effectiveness has long been proven in practice. It is not tightly fitting to allow easy breathing and is water resistant to prevent wetting to outer surface by droplets. So it's comfortable and safe to use for hours.
I see. Compared to the KF94 that we have out in the market.
Right.
Jim, are there any questions that you would like to ask Professor Kim about masks in general?
I mean, I think a lot of people overseas still don't really understand that much about the different kinds of masks available. Obviously, here in Korea, there is a large variety of masks available, some of which are better for doctors, some of which are better for the public. So I was wondering if you could just explain a little bit more about the different options and what they do.
Yeah, I brought several kinds of masks today. And if I am a doctor taking care of COVID-19 patient, I will choose only this one. Yeah, and if you need to wear N95 masks as healthcare workers, you must take a medical exam first to check respiratory function is right, and then you must. And then using special monitoring instrument, you should choose the certain model of N95 masks providing you tight sealing without any leakage around boundaries. And in addition, you should conduct self-testing test each time a mask was worn. If the mask is perfectly fitted, actually, you surely have sore and even damaged skin on your face. The KFDA instruction of KF80 and KF90 mask also require self-testing each time. Furthermore, there are more protective equipment required, as I said, goggles, face mask, and long sleeve gowns or level coverers and even shoe covers to protect every inch of your surface. And so now you can see how difficult it is to use mask to protect airborne particle. So I'd like to give you the first warning in this time. Do not believe the mask protect you. Well-known side effect of mask wearing is actually false security.
Just for it offers you a false sense of security, did you say?
Yeah, false security sense.
I see.
Yeah.
What about for members of the public who aren't doctors, who aren't in medical situations? What kind of mask would you recommend for them?
And for public situation, actually, it's the reason why everyone to wear mask is the new normal these days. I would choose a surgical and dental mask like this.
Oh, could you hold it up a little bit so we can see it?
Yeah.
That's a dental mask. The one in blue. And you would recommend this for members of the public?
Yes.
Okay. Why?
Yeah. Because I already explained you that this mask is its effectiveness has long been proven in practice and comfortable and easy to breathe. And I think this one is also similar to
Can you
dental
show me
mask.
that?
Yeah,
Yes, for our viewers. What is the difference between the blue one and that one? Because they both look like dental masks.
Yeah, I think so. And it's, this design and material come from a surgical mask, I think. And so actually I tried everything by myself, and I think this one is very similar to the function and feeling. And then I prefer the cotton mask. Next is officially recommended for public use in United States. It's great to wash and reuse it. And the KF mask is not safe for long-term public use. Actually, the KFDA noted warning precautions for children, the elderly, and pregnant women, and the patient with respiratory disease.
for masks that are KF94?
Yeah, actually KF8 and KF94 has same precaution warning by KFDA.
For long-term wearing then?
Yeah.
So for these people, you'd recommend them to wear either the cloth mask or perhaps the surgical or dental masks?
Yeah, and actually this one is most comfortable to wear.
That's what my daughter keeps saying.
Yeah.
So she refuses to wear the KF9480. She would choose the dental mask. And I've always been wondering whether they were safe. But now hearing from you, you claim that they are safe to wear.
Yeah.
I see. All right. Professor Kim, let's take a few minutes now to touch upon the facts and fiction of COVID-19. We'll take a look together at some statements on the screen. I will read the statements out to you. And for each one that I do, you would choose an O if it's true, as in yes, and perhaps an X if it's not true or false. Is that okay? Because there are a couple of statements that I'm also very curious to know about. So the first one is, you can catch COVID-19 through delivery boxes. Is that an O or an X?
It's a difficult question. It's a O or X, both of them. Yeah, everything outside home could be touched by others. So I cannot say it's particularly the delivery package is particularly at the higher risk of COVID-19 transmission.
I see. So there's both a chance of yes, you can, and no, you cannot then. So the best thing would be is you bring the delivery box into your house and then perhaps disinfect it. Would that be safe?
Yeah, and everything outside home could be touched by others, and so it's same.
I see. Yeah. Okay, Professor Kim, you can be infected with COVID-19 through mosquitoes in the summer. Is that true or false?
It's definitely false. COVID-19 is not blood-borne transmission disease, so it's false.
Okay. It's dangerous to wear a face mask while jogging. This I have to ask, wouldn't you as well? Because we do exercise, do we not? Like to keep our health.
And it's very sort of difficult to breathe if you're exercising with it over your nose especially.
Right. Is it false or true?
I think it's true. There is evidence that mask wearing could interfere the oxygen saturation of wearer.
Right, and there was a story of the two Chinese boys, I think, who reportedly died while during exercise period, I think, with their masks on. Right, okay, one more then. You can be infected with the virus while you're in the water, true or false?
It's also true or false together. And and transmission risk can be increased by contacting people closely in the water, not water itself.
I see, okay. So it's not the water that's a problem, it's the proximity between you and the person inside the water. Okay. I have one more. I know I told you that was the last one, but this is out of curiosity. Turning air conditioners on indoors, does it raise your risk of infection?
It's very important question. It's also false or true together. Droplet is too heavy to be airborne, but only extremely tiny so-called aerosolized droplet can be airborne. So droplet size is dependent on the activity of people who generate droplet. Usually the size, order of size is when talking is larger, and then coughing the smallest in sneezing. So if people talk like this in usual tone, air conditioner hardly facilitate airborne transmission of COVID-19.
I see. All right, Professor, thank you very much for your thoughts today. And Jim, thank you very much for being with us today.
Thank you.
And that is all the time we have for today. Do join us tomorrow as we shed light on the National Health Insurance Service here that has made early testing and treating of COVID-19 possible. In the meantime, do reach out to us with your thoughts and inquiries on our social media accounts or our homepage, arirang.com. Thank you for watching.